So I'd like to introduce you, Ross. Let me see if I can remember a bit about your life. So thank you for joining us for this meeting, Ross, and I'm really pleased to have you on the podcast. Just for our listeners, Ross and I have known each other around the vet professional world for at least 40 years, I will say. Back in 1978, I think, is when I first met you at a bird conference in Sydney. And I really admired your broad range of view of life, including the spiritual connections that you find with the animals and their life. So I think, Ross, and you can correct me later after I introduce you, I think you might be one of the first specialists, veterinarians in this country, if not the world, and your specialist area in avian health and medicine is really forefront amongst our professionals. And I see that you graduated with honours from the University of Sydney in your vet career, and then you studied caged and aviary bird health medicine and became a member and I guess a fellow, yes, fellowship from the Australian College of Veterinary Scientists, which is the foremost body specialising veterinarians. And after selling your practice in Sydney, I think you came up to live around the Gold Coast, and now you have a 100-acre property in a Lillian Rocks area outside Nimbin in northern New South Wales, where you write books and have a very interesting life, which you might like to talk about perhaps a little bit later on, about your own health journey. Is that about right? Did you want to correct any of that?
That's fine. No, I was Australia's first registered bird specialist in cage and aviary birds. There were two other bird specialists ahead of me. One in commercial poultry farming and the other in pathology. Rod Reese was in pathology, and I've forgotten the guy's name, but anyway.
But really, one of the foremost early leaders in our profession, yeah?
The first one. We only had 1 hour's lecture in medicine in our undergraduate course in cage and aviary birds, and we only had 1 hour's lecture in surgery and anaesthesia in cage and aviary birds. And
yeah, not much.
During that, we were told a few lies as facts. But anyway.
Yeah, that's medicine for you, isn't it? You know, what we didn't know and what we know now and what we're continuing to learn.
Yes.
Which is kind of fascinating, and how we're always learning.
We're always learning, that's for sure.
Yeah.
Anyway, today's topic was basically an introduction to keeping birds as pets, and I'll focus on, say, budgies and cockatiels. It doesn't matter really, but they're the ones that are most popular and for good reason. And I'd like to start with why choosing cockatiels as pets. There are many types of, or budgies as pets. There are many sort of strains or subspecies, as you like to call them. So you've got show budgies, and you've got pet budgies, and you've got wild budgies, and all sorts of in between. And they vary very markedly genetically. Some only have a life expectancy of about 3 or 4 years. Some of the show budgies and some of the older style budgies, for instance, may go through to nearly 20. And with cockatiels, that might go up to 26 or something like that. So budgies can learn to be taught to talk. Cockatiels can be taught to whistle. But otherwise, there are many similarities between them.
So I'm surprised some of those show budgies only live 3 or 4 years. I always thought the birds would live into their teens, though. So we've done something genetically to make them not live so long.
Yes, that is why I advise in my budgie book, and also in my book Caring for Birds with Love and Gratitude, not to buy show birds unless you're really into showing budgies or cockatiels, to avoid show birds as pets, because you've got a far better chance of having a nice long-lived pet bird. If you, all right?
So would you say if you're into budgies, go for the wild type colours like the green and yellow ones?
Yeah, green, yellow, blue. The rarer the mutation, the more highly inbred that bird will be, and that reduces genetic diversity and so forth. So they become more susceptible than the wild types. And you want the little budgie, maybe 35 to 40 gram budgie, rather than the 60 gram budgie, which some of the show birds now are.
Yeah, they're getting kind of fat. Yeah.
Yep.
And so are they predisposed to, say, abdominal lipomas and fatty tumors, the ones that don't give us one?
Pet budgies as a species are known as cancer factories in the bird world, because they carry viruses that predispose cancer or are linked to cancer.
Oh, is that like the retroviruses?
Yes.
Oh, I didn't know that.
Yeah.
So are any of those viruses in budgies transmissible to humans? I mean, I don't really want people to not have pet budgies, and I don't want to scare them, but do we have any evidence?
Yeah. Well, I am not sure of the answer to that. I know the answer is probably suppressed.
Okay.
I think you'd have to be unlucky all the same to develop disease from catching a virus from a budgie.
From a pet bird.
I certainly don't concern myself with it.
Okay, yeah.
Put it that way. I think it is possible. Same with beak and feather disease. I've had circovirus. I don't think that's published information, but from my dowsing using a pendulum and all that sort of work that I've done, I've had it, and I've cleared myself of it.
I'd just like to mention to our listeners that you are actually the vet, together with I guess it was a microbiologist, who found the microorganism that caused, which is the virus that caused Psitticine beak and feather disease. Because I know when I was at university in 1970, 76, 77, we were still taught that those cockatoos that lose their feathers and go bald and have the beak and feather disease, that was actually caused from eating too much sunflower seeds, which isn't correct, right? And then you went out on a limb and went, well, look, mate, if we stop feeding them sunflower seeds, they should be better, so that doesn't make sense. So you are one of the most logical people and also the most far out person. And then you found the virus, right, which was the circovirus. Did you want to tell our listeners about that story a little bit?
Well, we were taught in that hours lecture in veterinary medicine back in 1970 or 1969 probably, that it was due to too much sunflower seed in the diet. So during my first year of graduation, I was over at Forestville Veterinary Hospital. I saw a typical case per the description at uni of this beak and feather disease, which I've forgotten what we called it back then, but anyway, I named it Psitticine beak and feather disease. When I knew a little bit more about it, I called it beak rot in the cockatoo when I published a little article on it. But anyway, that bird got worse and worse and worse. It was a delightful birdie. It lived at Beacon Hill, and eventually it died. And I decided to find out what the truth of it was. I certainly knew the truth was not that it was due to too much sunflower seed. So it took me 8 years of sending specimens to the local laboratories, to the local university, etc., before I published an article in Proceedings 55, I think it was, of the Postgraduate Committee. And as a result of that article, where I published the pathology reports that I had been given, amongst other things, on beak and feather disease, which were totally rubbish. You know, the bird died of chlamydia, or it died of something or other, or all sorts of secondary problems, not the primary problem. Anyway, Dr. David Pass of Murdoch University wrote to me and said, would you like me to help you? And I said, certainly. So I started sending specimens across to him, and within a short period of time, maybe 6 months or whatever, we had the answer, because he agreed to look at the tissues that I had been asking the other pathologists to look at, and they had been ignoring. You know, I asked them to look at the thymus and the bursa of Abricius, and they were just looking at the gross organs. But anyway,
yeah,
we
have to keep pushing, don't you, to look for things. If it doesn't make sense, you have to keep asking questions, don't you?
We do have to keep asking questions. Anyway, I had 8 years of asking questions before I got someone to really help me.
Oh, you don't give up. That's a good thing.
No, and I haven't given up yet.
Ross, I have to actually just go and do a consult. So what I would like, I'm still recording. Would you mind just continuing on about some basic health care things about birds?
Sure,
I'm going to duck out and just keep recording, and I'll come back. Just keep talking. Okay.
Okay, all righty. I'll certainly do that. Okay. All righty. So I've said about choosing a cockatiel or a budgie. Choose a pet style one rather than a show bird. Always avoid buying a pet bird with its wings clipped. Purchase a young cockatiel or a young budgie if you want it to become tame. Now, by young, I mean it is just able to feed itself. So that's round about six weeks of age. If you get one younger than that, you have to be experienced in hand raising to avoid cruelty issues. So if you buy one that has just learnt to crack the seed and feed itself, then you're underway. Buy a birdie without clipped wings, and avoid buying obviously sick birds. And if you're looking at cockatiels, avoid buying cockatiels with bald heads behind the crest, because that's a genetic fault in many of the Lutinos and albino cockatiels, where they have a bald head behind the crest. Always check the feet of the bird and make sure that they've got normal footprint and haven't got sores or worn areas on their feet. Plan to matchmake your first bird with a young tamed, or choose a male first of all, and then plan to matchmake it with a young tamed female within the first year of life, if at all possible. So we can expand on these questions, but we're going to just move through quickly, and then if you'd like me to expand on any of this, I will. Where do you get your first bird? Do you buy it from a pet shop or a breeder? I would always choose a breeder that I knew, if at all possible, over a pet shop. It might be a backyard breeder, but I would get young birds that I knew the age of, and I would get them so that they grossly appeared normal, but I would advise a health check from a bird vet. If you've got a bird vet nearby who's worth his or her salts, get them to check the new bird. We'll go on to, so buying from a breeder is probably the best way. Recognising the health and disease of sick bird. Look, there are many considerations for these birds, and we'll go through those later on. But if the bird looks at all sick, if it's got snotty or pussy nostrils, or a blocked nostril, or if it's got a sore eye, or if it's got vomit or uneven plumage around the head, or if it's got a soiled vent, meaning that the vent is stained outside the vent with feces, or has feces adhering to it, those all indicate problems. If the bird is breathing heavily, that indicates a problem. If the bird's keel bone is prominent and the muscles are concave over the keel or breastbone, that indicates that the bird is chronically ill. So there are lots and lots of signs of disease that we'll talk about later on. Remember that the way you handle the birdie makes a huge difference to whether you're going to tame it or not. If you treat it as a sentient being, similar to us, with similar feelings to us, and takes some time and all that sort of business, that birdie will become a much better friend than if you just stick your hand in and manhandle it, so to speak. The sex of budgies is generally easy to tell when they're young by the colour of the cere. Males, if they're normal colours, they will have a blue cere. A female will have a pale cream or brown cere. The changes occur in the nostrils in the cere around about 4 weeks of age. The females start with a bluish cere, but then the area immediately around the nostrils will start going creamy, and that will spread across the cere. Whereas in the males, that will stay blue. In several mutations, that is the albinos, the white ones, the lutinos, the bright yellow ones, and the pied budgies, the male cere is not blue, it is a mauvey colour. So note that as well. In cockatiels, it's if they've got stripes under their tail, then they're going to be female. If they've got a solid tail marks, they're going to be male. Anyway, you can get help from your local vet as to what sex. There are lots and lots of problems that we need to face when we're going to buy a bird, and making sure that our environment is free from bird hazards is an important one. So making sure that you've got no mice, no rats, no rabbits and guinea pigs, no snails or slugs, no possums, snakes are all factors that need to be considered. Other issues are whether you've got any other pet birds, whether they're compatible or incompatible. Tortoises and turtles in the aviary can spread disease. Cockroaches obviously spread disease. Mosquitoes transmit various issues. So they're all things that need to be considered. The size of the cage is very, very important. Pet birds are not helicopters. They don't fly vertically up and down. And many of the cages that we have in the pet shops are designed for helicopters or not even for flight. I believe that if we have a bird that is of this species, then we should provide it with the opportunity to fly each day. And if you're going to keep it confine it to a cage, then the cage needs to allow at least 3 wing beats between perches to give it a little bit of exercise. Obviously, if you can allow it to fly around a bird-safe room, that is much, much better. So,
thanks, Ross.
Yep.
Finish that consult. So you covered a fair bit now. Would you like to recap?
Yes.
So you talked about food and housing.
No, I haven't really spoken. I'm just talking about housing at the moment. I haven't spoken about food as such. There's so much that we can talk about. And
there is, yeah. So this will just be the start of the first podcast with you. Yep. And if you feel that you've covered enough for one podcast, we can just save this one and let people know. So what we'll call this one about housing and husbandry. Would that be about right?
Maybe I'll just talk a little bit more about bird cages. I've spoken about the need for birds to fly.
Okay.
And to have a cage long enough. So the length of the cage is the most important aspect, and the longer the cage, the better. And I've suggested at least 3 wing beats between perches with area to fly in. and being allowed to fly in a bird-safe room of the house for maybe half to 1 hour a day or more is a good idea once you've got the bird tame. Harmful perches are mostly sold with bird cages, so dowling perches are no good for the feet. The mineral perches that are coloured mineral perches are no good for the feet. They abrade the feet or cause pressure sores over a period of time. Basically, natural gum tree branches, wattle branches, Brevillea branches, Melaleuca branches, paperbark branches, those sorts of things would be far, far better for your birds. And depending on the size of the cage, you can vary them considerably from perches that cause the feet to spread right out.
Yeah. Yeah, because we do see that a lot, don't we? They get like pressure sores because they're not able to change where the pressure points are when all the perches are the same width and the same size. And also putting like sandpaper over them is really quite cruel too, isn't it?
Yeah.
So, and of course, as you've mentioned, you're talking about non-toxic branches so that if they chew them and eat them, they wouldn't be poisonous. So you wouldn't put something like poinsettia branches or Plumeria frangipani branches.
Or anything like that. No, I have in my Keeping the Birds with Love book a list of safe trees and shrubs to use, and some of the more common poisonous ones as well.
Yeah, and so we'll put a link underneath this podcast when I get my IT people to help, and they'll be able to click on, and will they be able to purchase an ebook from that site if they click on it? Okay, so that will be nice and easy for people to get a bigger, broader view. And so, so thanks, Ross. That was a decent chat. Was there anything else that you wanted to mention about husbandry and keeping birds? And we can do another podcast about food and different types of food at another date.
Lots more.
I know, lots more.
Yeah. Summary overview.
Okay. So shall we call this one a day so that we can check our... okay. Well, I'm glad that we caught up with you, and we'll do several more of these, and we'll just do like a sound check and make sure that this is loud enough and I was able to save it. So, okay, have a good day. I'm just going to end it now, and thanks for logging in. Have a good day. See you. Bye.